I would like to take this opportunity to introduce you all to Kingston's Mental Health Parliament. All those involved in Kingston's Mental Health Parliament are rightly extremely proud that this is the very first mental health parliament of its kind in the United Kingdom. The Parliament was officially and successfully launched in June of last year. So, what is the Kingston Mental Health Parliament and why was it set up? While some people have good experiences of using services, there are a number of people that do not. Kingston Mental Health Parliament are a group of mental health service users and ex-service users and carers. Through the user involvement service of Mind in Kingston, we have come together to establish a user-led collective advocacy for people who are or have used mental health services in the Royal Borough of Kingston, as well as people who are carers of mental health service users. We aim to improve the experiences of mental health service users and carers and their interactions and treatment within their community. We do this by addressing issues affecting service users and addressing issues that matter most to them. This could be issues or problems arising with the community mental health team, GPs, dentists, or even your local library or newsagent. It is not up to the Parliament to decide what we address, but those that use our services and the issues that they bring. However, it is important to stress that we do not provide individual advocacy or support, but we are able to signpost to the most appropriate resource. The Parliament comes under the umbrella of Mind in Kingston's User Involvement Service, but we wanted this to be more than just mere involvement, although we sincerely value any involvement, but uniquely to the Parliament, every possible decision, direction, idea, concept was to be led by service users, and so that led to the initial steering group being set up. Some of you may know that staff at Mind in Kingston have been working on setting up the Parliament for a long period of time. In the past, some things didn't go to plan, and resources, sadly, had played a part. However, throughout that time, we have had a number of service users working behind the scenes, gathering information and devising the structure of the Parliament. This includes our current team of MPs and the steering group. Empowerment. The Kingston Mental Health Parliament seeks to empower service users at all levels, for example, keeping them informed and updated about the Parliament, actively sharing information, monitoring and robust feedback, and also supporting participants, accessing our service and providing ongoing training for all our volunteers. Development. An important day in our development was our Open Day held in August 2013, in which over 40 people from the borough attended. This was an invaluable day of information sharing and gathering, and also many ideas were put forward on how to address and approach the huge array of possibilities in designing the Parliament. It has always been vitally important and remains a key feature of the Parliament that every individual is listened to, and where possible their ideas, experiences and feelings are taken into account when implementing the formation of the Parliament. Everyone within the Parliament has an equal and full opportunity to express their ideas. Apart from 2 Mind in Kingston employees, all those involved, both past and present, are volunteers and have given their time, commitment and energy to this project week after week without fail, free of charge. Their work, dedication, commitment has been and continues to be outstanding. An example of the standard of work can be seen in our Parliament Handbook, written and compiled by Mandy Allison from the original steering group. The initial training period for the first round of MPs was very in-depth 6-month training course and covered all areas involved and expected in providing a professional service with a good practice for service users within the borough. Surgeries are held in various locations and times across the borough. These typically last for 2 hours in total, and we offer each individual 20 minutes. You will be seen by one of our trained MPs and a scribe who will take notes and feedback the concerns expressed for clarification. The MP will also explore your concerns and issues and see what has been done so far. This information will be taken back to the group meeting of MPs. Importantly, we offer a confidential service, and in line with Minding Kingston's policies and procedures, people's personal details are to remain confidential at all times throughout the process. When the same concern has been raised 3 or more times in a 6-month period, the Kingston Mental Health Parliament will decide what action should be taken. This could be inviting the manager of the service concerned to meet with the Kingston Mental Health Parliament and working together to resolve the issues to the best of our abilities. However, in more serious cases or when there is no response, the concern will be reported to the governing body or higher management of the service. We currently have 3 regular surgeries up and running in the borough. Issues raised have varied from inadequate or non-existent discharge plans from the community mental health team and hospital, access to home treatment team, general practitioner involvement, local policing with regard to people with mental health issues, general hospital, and the effectiveness of the telephone interview process used by IAP's assessment service. Our current surgeries that we run in the borough are held fortnightly at the Cambridge Road estate, monthly at Fircroft in Surbiton, and fortnightly at Sidley House in Minding Kingston. Once again, I want to recognise all our volunteers for their tremendous hard work and support that they give to the Parliament each week. Without them, this service would not be available.